Advising in udder health means also advising in housing, management, etc. Several factors on farm can influence the occurrence of mastitis. It is important to raise awareness on managing udder health at farm level because its impacts are tremendous. The first one is longevity. Many cows leave the herd too early. For example, in Europe, 20% of dairy cows are not completing their entire first lactation. It is to be noted that the most efficient lactation is around number 7 or 8. So there is a huge interest of cows living longer. Minus 30% of methane emissions, half young stock needed for replacement, and better feed efficiency. The second impact is resilience. Today, 30% of dairy cows suffer on farm from lameness, mastitis, ketosis, etc. As all diseases are linked somehow, it is important to ensure disease-resistant management. Then comes the cost, of course. Different estimates can be calculated about the cost of mastitis, but €225 per case is generally accepted. And the biggest part of that figure are not the direct cost, like treatment cost, but indirect cost, discarded milk and production loss. This should also consider the disruption in daily work. The time needed to manage a single case has been evaluated at 4 hours in total. Then, cure risk is sometimes very low and isn't necessarily worth investing without compromising animal welfare. Advising needs to have a broad view to evaluate all available parameters and follow the look, think, act approach. And finally, ask yourself about who's in control. Your attitude is important, but the farmer's attitude as well. Is he aiming to reduce mastitis on his farm? What is his reaction when facing a sudden rise of mastitis cases or bulk tank milk somatic cell count? 60% of farmers don't call their vet when there is an outbreak of mastitis on their farm. Half of them see they have a problem but don't have the solution. The other half don't see the problem and obviously don't know the solution. So there is room to progress here, but this needs to be proactive rather than trying to solve problems when they occur and you are called. Move from curative to preventive medicine. 4 important points in decision making when advising on udder health. Awareness should be raised to farmers, especially by comparing them to others. Benefits of a solution should be provided or highlighted. Costs and efforts needed to implement recommendations as well. And disadvantages and negative experiences has to be kept in mind. So A plus B should overcome C plus D to ensure the most profitable solution can be agreed with the farmer. As an example, it has been shown that teat post-dipping, known as an efficient preventive measure, has a net benefit of €0 because reduction in losses is compensated by increase in expenses. Another example with milking infected cow last. Negative net benefit as additional expenses overcome largely reduced losses. So how to select the most appropriate solutions? The more information you get, the more specific you are. First, management. Will you look after reducing the number of new infections or the duration of existing infection if the goal is to reduce quickly bulk tank somatic cell counts? Infection dynamics help you have a better understanding of new intramammary infection occurrence and cured intramammary infection proportion. They need somatic cell count and clinical mastitis data. The origin of infection is also very important, dry period or lactation. Culture results will help identify pathogens that are present on farm. Together with infection dynamics, they will help defining a contagious or environmental epidemiological pattern. All this will have an impact on the most effective measures you can propose to your farmers. As an example, prevention of overcrowding will be one of the most effective measures in an environmental pattern, whereas milking infected cows last remains effective in a contagious pattern. It is important to get an agreement from your farmer, so he will be keen to implement your proposed measures. Finally, to close the loop, having a broad view is mandatory for advising efficiently. So be holistic.